Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, aloha and good morning. Thank you so much for joining us here on this Labor Day. I'm Yunji Denise. My co-host Ryan Kalei Suji is enjoying the holiday, but we are sure that he is tuning in to watch because today we have a very special guest. We've invited Dr. Tim Brown, who is a senior fellow with the East-West Center and an infectious disease expert. He gave an amazing talk about 3 weeks ago that you can actually find on YouTube about the Delta variant, what makes that different and why that is having such an impact in our community. And we really wanted to talk to him after watching that video. And we encourage you to also, when this is POW, to go take a look at it. It's on YouTube. So, Doctor, thank you so much for being here this morning.
Pleasure to be here, Yunji.
So let me just put you here, and just so that everybody knows, Ryan usually does all the technical stuff, so you'll have to forgive any errors that I make this morning, but the content will rule. And let's start with the basics for folks who haven't seen that talk. What makes Delta so different? Because there was this period starting around Independence Day where we really felt like we were turning a corner. I know that I had family from the mainland that came to visit, and there was this sort of light at the end of the tunnel. We were told we could take off our masks if we were vaccinated, and then suddenly that light at the end of the tunnel seems to be diminishing.
I think, fundamentally the primary reason why Delta is so much more of a concern is that it's twice as transmissible as the original virus was. So if we look at the original virus that came out of China, on average, about 2.7 people would get infected by every person who was infected, assuming they took no precautions. For example, they didn't wear a mask, they didn't socially distance, and so on. But with Delta, that number is up to around 6. So literally twice as many people can be infected by a single person with Delta as was the case with the original virus. And that means it transmits much more rapidly through the community. Okay. Now, the way it did this is it really evolved so that it could better attach to the cells in our nose, throat, and upper respiratory tract, such that we build a larger viral load. That is, there's more virus in our body. So that's the primary biological change that occurred. But there are also more subtle changes that have occurred. For example, it develops faster in the body. One study in China basically showed that between the time that you get infected and the time that you first test positive on a PCR, it used to be 6 days with the previous variants of the virus. Now it's about 4 days with Delta. So it actually builds up in the body much more rapidly. It also grows to much higher levels. So the viral load is about 1,000 times what the viral load with the previous variants was. And that means there's just a lot more virus. Basically, that if you share air with somebody, you're going to get a larger dose of virus, which means there's a greater chance of your getting infected. And the third impact of that is that because there's more virus, we will also see a lessening of the effectiveness of things such as previous infection and vaccines in terms of protecting. Now, they're still very valuable and they're still working very well. Okay, but they're less effective than they would have been against the previous variants. So, for example, the studies we've seen here in the United States, whereas originally we saw about 95% protection against infection with the people who were vaccinated very early, now we're seeing somewhere between 66 and about 88, depending on which studies you look at, protection. Now, that's still very good protection. That's much better than most vaccines will ever give us. And the other thing that I want to stress about the vaccinations, there are two aspects to vaccination. One is the protection against infection, which has been lessened a little bit. The other is protection against serious illness and death. Those have held up very, very well. And fundamentally, I think that's because the protection against hospitalization and death is basically due to your secondary immune responses, basically your body reacting to the virus that it has seen before if you were infected or vaccinated, and then responding very, very quickly in a matter of 3 or 4 days, basically to boost up its antibodies and bring the virus under control. So even if there's a breakthrough infection, it tends to be of a shorter duration among people who are vaccinated or people who had a previous infection.
Now, given the strength of the virus, and you're saying 1,000 times more virus, we have been trying to march steadily to the 70% goal of vaccination in our community. We're not there yet for people who have received 2 shots. And the sort of promise or goal was from government that once we got to 70%, we would be able to lift certain restrictions. With Delta and variants that might be coming, will we ever get to herd immunity? Is herd immunity still an achievable goal?
Okay, let me start by saying, herd immunity, first of all, is a theoretical construct. Okay, it's based upon what are called random mixing models where everybody mixes with everybody else. And in the real world, it never works that way. People work within social circles. They basically do not interact with everybody in the population and so on. But with that said, I mean, herd immunity gave us a rough guide. And with the earlier variants, the herd immunity would occur at about 67%. Okay. The problem is with Delta, which is twice as transmissible now, basically, and the fact that our vaccines are a little less effective against infection. I mean, still very effective against illness and death, but a little less effective against infection. The net result is that herd immunity will be pushed up probably into the 90% plus sort of level. So honestly, we need to be shooting for universal vaccination. And that's for multiple reasons. First, it's because vaccinated people are much less likely to contract the virus and they are less likely to transmit it on. And second, they are very well protected against serious illness and death. And I think that that's a really critical thing that we need to keep in mind. And the problems we're seeing in our hospitals now is, we've been told over and over again, about 90% of the people in the hospitals are unvaccinated.
Well, we saw numbers out today, over 700 new cases, and we see those hospitalization numbers going up. We've been told by the Blangiardi administration and others that 500 in the hospital is sort of their bright line in the sand, if you will, in terms of more restrictions. When you look at the numbers that we see on a daily basis, the case count and what have you, how do you see things trending? And do you think that we're going to get to that 500 relatively soon?
I mean, if the numbers keep where they are now, then I think we'll hit that 500 very soon. And that is a real concern because, as all of our healthcare providers have made clear, we have limited capacity here in the islands. And we have, I think, on the order of 2,200 hospital beds. We have a limited number, 300 something ICU units. And we're filling those up very rapidly with people with COVID, as well as people who have other medical needs. But we've already started to see those other medical needs deferred. Queens, Kaiser have all been canceling elective procedures or pushing them back. And that means people are being unable to get the health care that they absolutely need. And I think that that's a real issue. So where we are now is already concerning enough that I think we need to be taking more aggressive measures to bring this under control.
And what do you think those aggressive measures in your mind should look like? What would be effective in stopping this?
Well, I think the single most effective thing in the short term is universal masking and people keeping their distance and avoiding crowds. And I think that's where we've failed. Okay, I think a lot of people are out there not wearing masks. A lot of people are gathering in large groups. I mean, I go outside my condo here and I basically saw groups of young people basically gathering in large numbers over the weekend. When I left the university on Thursday, there was a whole group of 50 to 60 students outside in a tightly clustered group, most of whom were not wearing masks. And even though they're outside, if you're in a tight group not wearing a mask, Delta spread can still occur. So I think we failed in that regard. And I think that, we need to really stress to people the importance of that masking, social distancing. And the other thing that they finally started to highlight that they should have been highlighting more than a month ago, keep in your bubble. Stay with a small group of people where you can be fairly confident that those people are not interacting with a lot of other people in ways that will transmit COVID. Then I think we can be safe and we can achieve the same things that we achieved through lockdown last year without doing lockdowns. If people will actually kind of adhere to good masking, good social distancing, and keeping within bubbles. Those are the things that will work most rapidly. The vaccines are also critically important because already we've got about 73% of the eligible people in Hawaii already vaccinated. Okay, that's actually pretty good success comparatively. We still have a group of about 207,000 young people who can't be vaccinated because they're not eligible for the vaccine under current regulations. And those people we have to be very concerned about those children because they can still get infected and they can still transmit the virus. And so I think that is a real issue. But the vaccines provide incredible protection. And the other thing I want to stress is vaccines slow community spread very, very substantially. Okay, let me just give you a very simple example. Let's take the Delta variant. Okay, each person infects 6 other people. So let's just run through 3 cycles of that. The first person infects 6 people. Those 6 people infect 6 other people, which means 36 in the second cycle. Those 6 people, or those 36 people infect 6 other people. That's 216 people. We're now up to 3 cycles, which would be about a month to 6 weeks. And we've infected 259 people, starting from a single person. Now let's say they're vaccinated, and let's take the lower end of the vaccine efficacy, which is about 66%, so 2/3. So that person goes from infecting 6 people in a vaccinated population to only infecting 2. And each of those people, in turn, only infects 2. So first cycle, 2 people get infected. Second cycle, 4 people get infected. Third cycle, 8 people get infected. That's only 15 people over that same month to 6 weeks. So now we're talking 259 in an unvaccinated population versus 15 in a vaccinated population. And if you look at those numbers, you can see why we're calling for vaccine requirements to go into closed spaces, because they will radically reduce the transmission within those closed spaces. And that is absolutely critical to getting this under control.
Well, on that point, the Safe Access Oahu program that goes into effect on September 13th does call for vaccination requirements along with testing. And there's a question here, the city also, and the state rather, all the counties now have vaccine mandates for state and county workers. But those who don't want to comply for whatever reason, religious or personal beliefs or medical, they can test weekly. Uilani has a question. Why only make unvaccinated people test weekly? Is testing weekly enough of a sort of antidote to people who are not vaccinated? What do you think of that protocol?
Well, I mean, if I had my way, personally, I would be using rapid test and basically having people test on a daily basis if they're not vaccinated, because the risk is so much higher for those who are not vaccinated. For the vaccinated, I think just logistically, it would be impossible to test absolutely everybody coming into every building. And the vaccinated people are much less likely to be infected, much less likely to be transmitting. And so I think that, that's kind of a level of risk that I think we have to accept. Now, with that said, I would still expect all indoor settings to still be adhering to masking requirements, to still be adhering to distancing requirements, and basically taking the steps necessary to keep that workplace or that place of business safe. And I think, where that's challenging is places like restaurants where people take off their masks to eat. Okay. And so we have to accept that there will be some risk involved in going to restaurants. That's a bottom line. But, people will have to gauge, is that an acceptable risk to them or not?
I want to bring in, there's a lot of questions and comments here about schools. And Tanya Lee says, shut down elementary schools since they can't get vaccinated. What are your thoughts about the education setting right now?
I think, studies in the US that have compared, for example, schools that had solid masking requirements that were strictly enforced, did some testing of their staff and the students on a routine basis and so on, have managed to contain the virus. So I think that it is feasible to do that, but it requires a solid set of rules and regulations in place. It requires that they be adhered to, and that, somebody be checking on that adherence, I think, on a regular basis. And I think the real challenge here in Hawaii is knowing exactly what's happening school by school. I just don't know. We know we have a set of guidelines that DOH and DOE have developed that include masking, that include some distancing, although not as much as I would like with Delta, some testing and so on. But again, I think the question is, what's the implementation of those rules at the different schools? And I think that's something the parents need to talk to the principals and the leaders at those schools about and find out what exactly is each school doing in terms of protecting the students there. Because I think it is absolutely critical to protect our children. Now, the other thing I will say on schools, we still only have about half of our 15 to 17-year-olds who can receive the vaccine, or sorry, 12 to 17-year-olds. Only half of those have received the vaccine at this point, roughly. I think it's 55, 60% last time I looked. But there's still room for improvement there. If we can get those other students vaccinated, that will also help to reduce the risk, especially in the middle schools and high schools. And actually, it's interesting, if you look at the DOE website, high schools tend to be at the top in terms of absolute number of cases that they're detecting. So that does tell me something about levels of risk. I mean, I don't have the, it's hard to say without having denominators how many students are enrolled in each school and so on. But the fact that I think of the top 10, something like 8 of them are high schools is very concerning. And we can do something about that with vaccines as well. So I think there's room for improvement there.
One of the things that we talk a lot about on this program is pre-travel testing and the Safe Travels program. As you know, pre-travel testing was eliminated as a requirement. You can now go into quarantine, or you can show proof of vaccination. What are your thoughts on that? There's a lot of folks who are calling for the pre-travel testing to be brought back regardless of vaccination status. What kind of a difference would that make for Hawaii, if any?
Well, I think at this point, given how explosive the growth of Delta has been around the country, and let's remember, I mean, the U.S. has surged in the last month and a half on Delta cases. We're over, 100,000 cases a day and over 100,000 people hospitalized on the mainland. So we're talking about, huge burdens of disease in the populations that are coming to Hawaii. So I personally would prefer to see a testing requirement imposed. So that go back to having that 72-hour. If I could, I'd even reduce it to 48-hour, given how quickly Delta is able to develop. We know it develops faster than the older variants did. So I would even shorten that to 48 hours if that were logistically feasible. I just don't know with the testing situation in the other states. But then I would probably also impose a post-arrival test after 2 or 3 days, basically to, just do a rapid test or something to just make sure people aren't infectious at that point, because it is possible for people to slip through. Now, that would require we scale up our ability to do rapid test. And I think that's been one of the failures of the United States. We had major failures in terms of PCR in early March 2020 with CDC completely messing up our original test. So we were flying blind through the first part of the year. To a great extent, we're still flying mostly blind at this point in time, because there are rapid tests that can be done, which, if you are contagious, will generally test positive with a good sensitivity of 85, 90% or more. Okay, they're very effective at detecting people who are contagious because they have a lot of virus. And we should be making much more use of those types of tests. Other countries are doing that. In the UK, they provide everybody like 5 of those tests per person per week. And so they can use them. You can take them, for example, before you leave the house in the morning. If you should test positive on that, it means you are probably contagious, and then you should go get a PCR test. We've made no use of that here in the United States. And in fact, the FDA has regulations that have made it difficult for us to do that. But that would be a major step in the right direction. And in fact,
that's the first I've heard of that. Can you tell us a little bit more about that? Is that every citizen in the United Kingdom gets these 5 tests?
They can if they want them. And they're basically made available. Germany makes them available at relatively low cost. So people can buy them for, I think, one site I saw was selling them for about €2, so about roughly $2 per test. Okay, so they're comparatively cheap. So for $10, you could buy 5 of them for every work day, and you could test yourself before you left your apartment or your home every day. And that would tell you whether you were contagious or not. And if you test positive, that's the red flag to you to go get an actual PCR test and validate that diagnosis. So I think that, those could be a big help, especially in school settings and other settings where, people have to come in and out. That kind of testing could help us a lot, especially for those who are coming in unvaccinated.
Mm-hmm. I want to ask you a little bit about sort of where we are right now. We see those numbers climbing up, and you did say that there are methods, masking, social distancing, bubbling, essentially sort of putting a lockdown on yourself without locking down the community. Given the level of compliance that we're seeing, we do have a large number of people vaccinated as compared to other states, but do you think that's realistic, or do you think that the government will ultimately have to step in, given our hospitalizations right now, And, Dr. Char has said 28-day lockdown would probably be the standard. Do you agree with that? And do you think that that is what's coming?
I honestly probably would have done some form of lockdown weeks ago. This trend has been obvious. Basically, this trend has been growing for 8 weeks at this point. It started gradually. But to those of us who are actually watching what had happened with Delta and other places, we understood that what we were seeing right after the July 4th holiday was the beginning of a Delta surge. And, it was there in the variant tracking that the state was doing. It was there in what we'd seen in places like the UK and Israel where they tracked it. We were watching the growth of Delta across the United States all through May, June, and early July. And so we knew this was coming. And the problem is CDC ignored it. CDC discovered Delta the week after July 4th. All of a sudden it's like, oh, we're concerned about Delta now. We should have been concerned about Delta back in mid-May. In the UK, by mid-May, it had already been declared a variant of concern, and they were tracking it carefully. They were studying it extensively. They showed that it had higher transmissibility. So they were studying it very carefully, and they tracked it very well. Our variant tracking is still comparatively poor. We don't do enough samples on a wide enough basis to know what's really happening. We kind of ignore the beginning of an exponential trend, acting like it's not there. But again, if we had looked at our variant tracking and we looked at what had happened in other places, we would have seen what was coming. And so I was telling people back in May, this is what's coming. So dropping a masking requirement for the vaccinated right now, which CDC did in early May, was a huge mistake. And the governor was correct in keeping our masking mandate in place here. I think our problem, like you say, has been voluntary compliance has been comparatively poor. I think, and I think a large part of that issue is among younger people, because right now, almost 50% of our cases are in those under age 29. If you look at the new cases every week for the last 3 or 4 weeks, I think it's about 46% are below age 29. So that's where a lot of our community spread is occurring right now. And I think that's where compliance is the weakest.
And so given all of those factors, do you foresee a lockdown, the shutdown like we saw in March or last year in August?
If our trend continues the way it is now, there's absolutely no question we'll need a lockdown. Otherwise, our hospitals become totally overwhelmed. Our hospitals are already strained to the breaking point right now. Like I say, we are denying people care because we don't have hospital beds. We don't have the capacity basically to deal with that with the COVID surge. And if the numbers keep at the 700 plus level that we're seeing, in the last several weeks, then I see no way that we're not going to have to shut down to protect our healthcare system.
I think there's a lot of small businesses and others who say that if that happens, that's nail in the coffin. And I think, there's this sort of push-pull that's happening between the business community and people who are trying to just make it after so much pain economically. But tell us a little bit more about why that, in essence, why that has to happen.
Well, I think it has to happen if they don't start taking the proper precautions. I think businesses have a role in this. They are the ones who need to be enforcing masking indoors. They need to be making sure that their patrons and so on are wearing masks. If you're in a restaurant and you're not eating, you should be wearing your mask. That's actually what our regulations say, I believe, for restaurants. But what happens is people take them off as soon as they walk in the door, and they put them on when they come out the door again, if they put them on again at all. And so I think that, restaurants have a role to play in compliance. I know they don't want to play that role. But if they really want to, basically help to keep this under control so that they can stay open, then they've got to take a more active role themselves, I think, in helping to regulate, especially the younger population.
I want to ask you, Lieutenant Governor Josh Green, who, as you know, is also an emergency room physician, is in charge of the vaccine rollout and the Safe Travels program. He comes on this program regularly, and he has said that if you look at where Delta has hit before, it's about a 50-day surge to kind of burn through the community, and then things start to go down. And by his estimation, if Delta starts surging in our community around Independence Day, then we are around that 50 days, and things should start to taper off, if you look at those other communities. Do you think that that is the case for us? Do you see things trending the other way anytime soon?
I'm not a big believer in looking at other places to analyze what's going to happen in a given location. I think with COVID, it's been shown that we're very bad at predicting exactly what's going to happen. In fact, if you go and you look at the CDC models, they're all over the map. Some of them say we're on the decline already. Some say we're going to continue to shoot up rapidly. And so, predictions are inherently flawed. I will point out that other places that have higher vaccination rates than us have continued to see increasing rates. For example, Israel. Israel has only started to level off in the last couple of weeks after they basically implemented boosters on a large scale. So they've been using boosters basically to help to bring their epidemic under control, but they were in the same type of exponential rise we were in until about 2 weeks ago. So I think that, to say that on average it lasts about 50 days, I think is a misnomer. It depends on how quickly it burns through the population, how much susceptible population there is out there, and that varies greatly from place to place. It's also going to depend on whether the schools are open or not. Okay, if the schools are open and if measures are not in place to protect, that can accelerate the spread within a community. So I think that, there are a number of different factors that are very difficult to assess to use some blanket 50-day rule. I think let's watch where the cases go in the next couple of weeks. I will remind you, last July, we rose up to a relatively high plateau and we stayed there for about a month. Okay, so last July, our surge was basically up, plateauing, and then dropping. So again, I think we need to see where this goes, and I wouldn't try to predict where it's going to go in the next couple of weeks.
Let's take a long view and try to predict where it's going to go in the next couple, I don't know, months and years. How long do you expect us to be in this situation where we have these surges? In other words, I know you don't have a crystal ball, but how long do you expect the pandemic to last?
Well, I think, the Delta surge will almost certainly go on through October in the United States, maybe longer, because if you actually look, there are some places in the United States that are starting to come down now. For example, Mississippi and Louisiana, which is probably that it's burned through a lot of the susceptible population there. But there are still other states, Wyoming, South Dakota, that are still rising exponentially and very rapidly. South Carolina is the fastest state in the country right now. I mean, at twice the rate that we're rising. Okay, so very concerning there. So those states are just really getting started now. So they're probably not coming down for some time in the future. So I think we're going to kind of see a slow burn across the United States over the next couple of months. Then we're going to be into the Thanksgiving and Christmas season where people are going to stop dropping precautions again, getting careless, and we're probably going to see more COVID transmission. They'll also be moving indoors in the colder parts of the country. So again, we'll see transmission associated with that. And we don't know when the next variant's coming. That's the bottom line. We've had 4 major variants that have grown to global dominance. Okay, there was the original virus out of Wuhan. There was what's called D614G that most people have never heard of that took over between March and April of 2020. There was Alpha, which took over the world basically between December and April of this year. And then there's Delta, which has now taken over the world basically between April and July. Okay, so that's 4 major variants that have grown to global dominance. We don't know where the next one's coming from or when it's going to come. But part of the problem we have is that so much of the world remains unvaccinated. We've only vaccinated about a quarter of the population, which means that other 75% of people are unvaccinated and basically could give rise to new variants at any time. And I want to stress, new variants don't just come out of one country or the other country. They show up everywhere. The Alpha variant came out of the UK. The Delta variant came out of India. I mean, the D614G probably came out of Italy. So, they pop up in all places where you have a large unvaccinated population and a lot of potential for spread, because the more people are infected, the more breeding ground there is for new variants. And based on that, I'm going to say until we at least get the majority of the world vaccinated, I don't think we're going to stop this thing. We're going to see new variants continue to evolve. And right now, what we're talking about in terms of vaccinating the world, we're talking probably early 2023, which means we're probably going to continue to see the emergence of variants through next year. And we don't know where the next one's coming from, how bad it will be. Will it be more transmissible than Delta? Maybe, maybe not. Will it be more lethal than Delta? That's a possibility. We can't rule that out at this point. There are several mutations that increase immune escape. Okay, and some of those are starting to pop up, and some of the variants being tracked right now. So we don't know. And but I would say, if I was using my best professional judgment, I'd say it'll be at least 2023 when we get most of the world vaccinated before we'll really get a solid handle on this as a race.
Anne Marie Medeiros has a statement here, and there's a lot of great comments talking about just, the wisdom that you're sharing with us this morning. A lot of people really appreciative. And then I think Anne Marie kind of sums it up for how I feel when I hear you say 2023 for the world, and thus, having some control over this, that we are doomed. How do we plug along in this, and what do you tell people about sort of keeping faith, if you will, because that does really that is a hard truth to take.
We're not doomed. Okay, I think fundamentally what we're in the process of doing is transitioning to what epidemiologists call endemicity, which means we live with the virus circulating among us on a regular basis, but we take measures that basically keep the lethality and the severe illness that are caused by the virus to very low levels. I mean, people don't realize this. There are 4 other coronaviruses that circulate among us as common colds. They probably went through similar phases to what we're going through right now in the past. Some people say the major Russian flu epidemic in 1889 was one of the coronaviruses basically burning through the population. Okay? So it's not helpless. What we need to do is we need to reduce the level of illness and death. And the best way to do that is to vaccinate everybody. These vaccines so far have held up very well in terms of, even with new variants, protecting against severe illness and death. So the vaccines are key to getting control over this on a global scale. We've also seen they reduce the transmission. And we can adapt our vaccine technologies as we go. My understanding is Pfizer is already testing a Delta-specific variant of the vaccine right now. So we may actually have a vaccine that's even more effective against Delta. We know that boosters work. The Israeli experience in the last month or so is showing us that boosters are incredibly effective. They have reduced their levels of both infection among the vaccinated and illness among the vaccinated by a factor of 10 with boosters. And they have scaled up boosters very rapidly. And we're on the verge of doing that in the United States. We will probably start with Pfizer on September 20th. And so the boosters also, again, increase the protection against transmission. They also boost up your protection against severe illness and death. So the vaccines really can help us to learn to live with the virus. And I think that's ultimately what we have to do. And once everybody has either been infected or has been vaccinated, then we will reduce this to a steady low level, probably like a flu epidemic every year. It will probably end up being seasonal, coming out every fall, every winter in different parts of the world, and then spreading from there. But again, if we've set up our system so that most people are already vaccinated, it generally will not cause severe illness or death. It'll become a minor inconvenience eventually. Now, how long it takes for that to happen, we don't know. We don't have any good past examples of how long that process took. It could be a matter, maybe it happens next year, and maybe it happens 2 or 3 years from now. We don't know yet. But I think if we really push out the vaccines, we can have an incredible impact.
This half hour goes so fast, and I can't believe we're already out of time, but I want to give you an opportunity for a final thought. And I would ask that you share with us, because I like that you say that we're not doomed, because it does feel like that this will never end. What do you tell people about what they can control, because people want to feel like they have some agency. And it sounds from what you're saying like we do. We can mask, we can socially distance, we can get vaccinated. How do you sort of interact with the world right now yourself? Do you go to restaurants? Do you get only grocery delivery? I mean, I would just like to know in your own life, how you implement precautions and what you advise to other people knowing what you know about the virus.
Okay, I basically, if we go to restaurants, we do takeout. We don't dine in. Dining in my opinion, is too risky. When we go shopping, I generally go shopping Saturday night late in the evening, when there's virtually nobody else in the store. So it's comparatively safe. I don't have to worry about people coming up within 2 feet of me, not wearing a mask or anything of this sort. So it's a relatively safe setting. So I take precautions in my own life, basically to keep myself safe and keep my family safe, because to me, that's critically important. Even though I'm vaccinated, I do not want to be responsible for infecting anybody else with this. Because even though I might have a comparatively mild course of illness, the other person I infect may not. And I do not want to be responsible for that. So I think that, yes, we have an incredible amount of control ourselves. We control our masking. We control whether we keep distance from people. And distancing is important to go with that masking. If you're literally sitting 6 inches away from somebody's face, even with mask, you still have the potential for virus transmission. So that distancing helps. It's part of it. Avoid crowded indoor spaces. If you go into a crowded indoor space, don't stay too long. The longer you stay, the more potential you have for exposure. So there are a lot of things that are under our control. And that's why I say, I think if everybody would take those levels of responsibility and be cautious, then we could achieve the same effects that a lockdown would achieve just with masking and distancing applied very, very well. But again, I think the problem is that a lot of people are doing them haphazardly, if at all, and that's where the problem comes. So it's a lack of, I think, responsibility on the part of some people to protect others in the community. Masking is not about protecting me. Masking is about protecting other people around me. That's the fundamental reason for wearing a mask. I get some protective effect, but other people get a massive protective effect. Because if I'm infected, I'm not going to be transmitting it. So I think, those steps can do a lot to move us along.
There's so many accolades and compliments for what you've shared with us this morning. Renita sums it up. She says, please invite this doctor on the show again. And you know that we will, because I feel like we just scratched the surface. So we will powwow after this and set up another date, because we really, really appreciate it. Thank you so much for spending part of your Labor Day with us and for sharing this information. We really, really thank you for it.
Thank you, Yunji, and I'll be happy to come back anytime.
Okay, thank you. Thank all of you for joining us. I didn't get to put as many comments in the chat box and show them to the doctor, but we do invite him, of course, to read the comments later. And we, of course, encourage you to share this video. If you didn't know, this show also rebroadcasts on channel 50K Kai at 6:30 in the evening and 6:30 in the morning. And it's also available as a podcast. So this is a great thing to listen to in your evening commute. Please do share this video or whatever format you listen to and consume this content with others. I think the more people who can hear that kind of information, the better. Just what he said about the importance of vaccines. When you look at spreading, to go from 8 people if you're vaccinated versus over 200 if you're not. And remember that about 4% of those people in Hawaii will end up in the hospital. And that is what is contributing to these beds filling up. So, we covered a lot of ground, but like I said, we just scratched the surface, and we are going to invite him to come back again very soon. Talking about the rest of the week, Ryan will be back. That, of course, is helpful. Lieutenant Governor Josh Green will be on here on Wednesday, and then Hawaii Island Mayor Mitch Roth will be joining us on Friday. So again, please share this content if you can. Stay safe, wear a mask. A lot of what Dr. Brown said was sobering, but also encouraging, because we do have so many tools at the ready, and you probably have a mask in your house somewhere. Make sure you wear it. You might know someone who's not vaccinated. Please encourage them to get vaccinated. We will get through this, but it is going to take all of us. We thank you again for watching this morning. Aloha. Have a great rest of your day.
This episode of Spotlight Hawaii was brought to you by Chaminade University.